In the year 2000, when I started treating dizziness, I went to Emory University and I learned a lot about vestibular rehab. There are four kinds. You've got adaptation, substitution, habituation, and repositioning. And I also learned through the Cleveland Clinic a form of substitution that is basically neck therapy. And I remember thinking, why would I treat the neck if a person's dizzy? And back in 2000, actually 1997, 98, the idea of cervicogenic dizziness was very controversial. Some would say, no, you can't be dizzy if you have neck problems. Well, let me tell you, after doing neck therapy on people who are dizzy for years and years and years, I've learned there's certainly a place for neck therapy when helping clients with the tough cases of dizziness. Our neck is complex. I've heard some say that it's the center of our universe. And did you know that right at the base of our skull, we have 10 tiny muscles between the occiput, C1, C2, and those 10 tiny muscles are called the suboccipital muscles. They're very small, but they're very important. Those 10 muscles have the highest density of sensors, or I call them speedometers or GPS systems, of any other part of the body except for the eyes. So they're very important with our head's sense of stability. And actually what happens, just like a generator in a hospital, when the electric goes out, that generator automatically gets kicked on. We believe there are reflexes called like the vestibulocoelic reflex that kicks on when the inner ear breaks. And we believe that sometimes it can stay on too long, or the neck muscles can just get too tense, the joints can become rotated, and giving the person a false sense of where their head is in space. So with those tough cases that people say there's nothing else that can be done, I always say fix the ears, make sure the ears are as healthy as they can get. Then optimize neck health. Make the neck feel as good as it can. Make it as happy and healthy as possible. Normalize the range of motion between the occiput, C1, C2. Normalize the strength of the deep neck flexors. Work on the postural alignment of the neck. Make sure there are no dangerous things going on in the neck. Make sure your vertebral artery those arteries are working the way they should. And then work on getting that neck as healthy as possible.